Assalamualaikum and good afternoon, class.
Good afternoon, teacher.
Alright, today we are going to learn new topic. So, can you class guess what is this picture show?
The baby grow up.
Okay, nice try. Okay, the baby is growing up, and so today we are going to learn about growth and development for infant, but only we focus on 1 to 3 months. Alright. At the end of this session, I hope that you, the student, can and will be able to define what is growth and also what is development. Okay. And you will be able to explain the principle of growth and the development, state the factors influencing growth and development, and perform the assessment of growth and also development. So what is growth? Growth is a process which is physical maturations, which result in increase of body size and also various organs. Occurs by multiplication of cells and an increase in intracellular substance. Growth, you can see or you can measure it by weight, by height or length, by head or by chest circumference for baby. So that is growth. When there are an increasing of size, that means they are growing. The baby is growing, and if the measurement is normal, so it indicates that the baby is growing normally. So development is different with the growth. Development means process of functional and psychological function, a progress of skill and capacity to function. Okay. How the baby progress, how the baby are able to function the progress. Okay, it is related to maturation of the nervous system. Include psychological, emotional, and also the social changes. For example, reading and walking. You can see the baby can start walking from age 1 year old. But today there are no walking baby because we are going to learn only from 1 to 3 months old only. There are 3 principles for baby 1 to 3 months old. The principle of growth and development, which is first is cephalocordal directional, proximedistal directional, and the last one is general to specific. We will looking at one by one. What is cephalocordal directional? What is cephalocordal principle? Sorry. It is the development process from head downwards.
Head, shoulders, knees, and toes.
The child gain control of the head first,
Head,
then the arm, and
and
last
leg.
is the leg. Okay, good. We will look at it in further. I will explain further. Okay. Proximodistal development. It is the process of the directional development. Start from the spinal cord, your spinal cord, then followed by the outer part of the body. The sequence start from the arms, hand, to the legs, to the fingers and toes. It start from the center to the outer, The last one principle is general to specific. Infant motor development are very generalized, undirected, and reflexive. They able to waving arm, kicking the leg before they being able to reach and grip for an object. Okay. The growth occurs from large muscle to small muscle. Means that before, that's why they are able to waving arm first before they can reach or pull an object from the big muscle to the small one. Okay, what is the factor influencing growth and development? The genetic factor. Genetic predisposition is an important factor which influences the growth and development. For example, sex and race. The boys are usually grow up faster than girls. Okay? When they are born and girls during the baby. That means that yes, you are growing faster during the baby compared to your sister. Race. For example, there are few race which is from the Africa and they are bigger size compared to us in Asia. Prenatal factors mean what happened to the mother during the pregnancy. Maternal malnutrition is associated with intrauterine growth retardation. Maternal substance abuse means that when the mother is taking drugs, especially when the first trimester, it will cause the baby having the congenital defects. Maternal illness, this one like pregnancy-induced hypertension and also gestational diabetes may influence growth. As we all know that baby with GDM is bigger than normal baby. Postnatal factor means after the delivery, which nutrition, whether the baby receive good nutrition from breastfeed or formula milk. Okay. Childhood illness, if the baby was birth with an illness, it will influence their growth and also their development. Physical, psychological environment, cultural influence, socioeconomic status, and lastly is play and exercise. Also brings the factors to the development. If the baby is environment is good, they are able to play, they are able to touch the surroundings, they will have better motor control. Okay? Better. Okay. Growth and development monitoring. Assessment of growth. There are 7. When you do an assessment of growing, you can see from weight, height or length, hip circumference, BMI, internal closure, chest circumference, and also mid-upper arm circumference. For fontanelle closure, normal baby will have fontanelle closure at age 18 months. If the fontanelle closure happen too early, the baby might have immature fontanelle closure. Okay, look at one by one. The first one is weight. Weight is actually a good criteria and a good indicator of health and nutritional status of the child. Normally, full-term unit will have weight about 2.5 kilogram to 3.5 kilogram. When the baby is born, they might have 10% of body weight loss, but don't worry, it will gain back within 10 days of age. So this is the normal weight gain during first to 6 months. When they reach the 6 months, the baby weight will multiply by 2. Okay, for example, if the baby have 3 kilograms of weight during birth, by 6 months, they will reach about 6 kilograms of body weight. When the baby reach 7 to 12 months, it will have 3 times body weight. 2 years, 4 times of their birth weight. 6 years, they will have 6 times from their birth weight. Okay. This is the chart for boys' weight and girls' weight. Focus only for until 3 months old only. Okay. This is the normal range of body weight for boys, and this is normal body weight for girls. So you can see the difference, which is 5 to 1 kilogram is still normal, and the girl 4.6 gram is still normal for 3 months old. Okay. If the baby birth weight was 3 kilogram, as I said before, he will reach 6 kilogram when he is 6 months old. Is it true or false?
True.
Good. Is it true? About length and height. What is the difference between these two? Okay, length, we measure it when the infant is lying in recumbent posture. It's taken from crown to the heel. Alright. The height is measurement when the child is
standing upright.
alright, standing upright. By the first year, height increased by 30 centimeters, which is 50% of their birth height. Okay, this is how we measure the baby length. Okay, from the crown to the heel. Okay, the baby will lie flat. Then the nurse will measure it.
What is length?
Length is the baby height. Okay. This is the boy's height, and this is the girl's height. Normal range of their height and length. Okay, for girls and for boys. Okay. After we measure the body weight and body length and also body height, we need to measure also the BMI. The BMI for children, we still measure it until they are 5 years old. Okay. BMI is to assess the normal growth or its deviation. It means that if the baby having BMI more than 30 kilogram per meter square, it indicates obesity in the baby. But if the baby having or have the BMI less than 15 kilogram per meter square, it indicates malnutrition. So the baby is not receiving enough nutrition. How about head circumference? Head circumference related to growth and development of intracranial volume. Okay. And average head circumference usually about 35 centimeter at birth. When they grow up to 3 months old, it is about 40 centimeter. Okay. What if you measure and then you notify that the baby head circumference increased more than 1 cm just in 2 weeks? You need to notify the doctor or refer the baby to the doctor because it may indicate hydrocephalus. How to measure it? Okay. To measure head circumference, you just need a normal measuring tape. Okay. Just put the tape above the eyebrow and above the ear to get the right measurement. Okay. For chest circumference, normal chest circumference is from 30.5 to 33 centimeter. Usually, the chest circumference is less than head circumference. Okay. Chest circumference measure on the nipple line using the normal measuring tape. If you notice that the chest circumference is less than 30 centimeter, the baby may indicate prematurity. So if you see the left side of the chest is larger, it may indicate that the baby has an enlarged heart. Okay. This one is not a measurement that usually practiced in normal baby in Malaysia, which is mid upper arm circumference, which help to assess the nutritional status of younger children. Average mid upper arm circumference at birth is 11 to 12 centimeter. How to measure it? Put a measuring tape, normal measuring tape in the center of your mid upper arm. Your mid upper arm and the middle of it. Just measuring it. Okay. Finish the assessment on the growth. We proceed with assessment of development. Okay. The development means gross motor, fine motor, cognitive skill, personal and social skill, and also vision and hearing. What is gross motor development? Okay. The skills that use large muscle, which is your legs, your arms, your trunk, and also neck. Okay. For 1 month old, the baby head books when held upright, kicks feet when on back. When the baby is lying on the back, it will kick. Okay, for 2 months old baby, the baby will able to lift head briefly when placed on tummy. When you do tummy time for your baby, the baby are able to lift a little bit of their head. On 3 months old baby, this one, they get stronger. They can lift their head up to 45 degrees of surface and push up with forearms when placed on tummy. Hands together at the baby will able to put your hands together in the midline of body. Okay, some baby that are fast develop. At 3 months old, they are able to turn down. They are able to lying in prone, lying on their own tummy, but they are able to turn back. So you need to help your baby to turn back to the supine. Okay. This is the first phase of motor response. When you on a loud noise, the baby will symmetrical abduction and extension of the extremities when you put on the loud sound. And the second phase of the motor response, symmetrical abduction and flexion of extremities accompanied by cry. Okay, head control. 1 month, when you try to pull the baby, the head lags after the shoulder. Okay. They are unable to control their neck muscle. Okay. This is the difference when the baby is 3 months old. They are able to support their own head. So his head moves along with the shoulder. When you pull, if you try to pull up the baby, the head will follow. For trunk control, the newborn lies tightly, flex the pelvis with pelvis high and the knee under the abdomen. Okay, this is how the newborn lie on, because they have no control of the trunk yet. At 2 months of age, the infant extends the hip and able to pull the shoulder up slightly. They are become strong, but when they are 3 months old, they are stronger. The trunk control are good. 3 to 4 months, the infant keeps the pelvis flat and lift the hips and shoulder. That means they can control the trunk quite well. This is sitting position, newborn, 2 months and 3 months old baby. You can see the difference. At 1 to 2 months of age, head is held up intermittently, but trunk control is flapping when they are put in sitting position. At 2 to 3 months of age, the infant raises the head and shoulder well, but lack control of thoracolumbar area. They are unable to control their thoracolumbar area yet. At 3 to 4 months, the support of the lumbar area is required to sit. You need to hold the baby very well, but this one you need to support. For baby, be able to sit with support. fine motor skill. They have skill to control their big muscle. This is the skill that use small muscle. For example, hands and finger. Okay. 1 to 2 months old, baby hands is most likely be clenched most of the time with little finger wrapped around his thumb, like this. 1 to 2 months old. They grab their own hands.
3, 4.
Okay. You can grab anything you put inside your hand, like rattle, but won't be able to do anything with the toys. If you put toys inside the baby age 1 to 2 months, they will hold it tightly, but they won't let it go because they also won't do nothing with the toys. They will hold it tightly. Okay, that's only they can do with your fine motor. When placing the finger in the baby palm, the finger will grasp. You put your finger inside the baby, they will grasp it, but they do nothing. Different with 2 to 3 months old, baby will start to relax their hand. Their hand is partially most open all the time. They are not grasped already. They are partially open. If you put some rattle, he will grab. Maybe bring it to mouth and let it go when he lost interest. They are able to control their fine motor. Cognitive skill, mental skill. How they think, how they learn, and how they solve their problem by age 1 to 3 months old. Okay, for 1 month old, they are able to look at people's face. They become quiet when pick up. If they cry, they pick up and they quiet. Okay. 2 months old, they are able to follow person and object that moving. Stay awake for longer periods and they start to smile. Start to smile. Okay. What is the cognitive skill of 3 months old? They look at their own hand. They are playing with their own hand. They are able to feel object with hands and mouth. They start to put things inside their mouth. They are able to turn eyes and heads toward sounds. If you ring the rattles, they are able to turn to the sounds. And they are smart to similar people. Personal and social skill. 1 month to 2 months old, they're just crying, but the parents need to know what is the crying for. They start to smile and respond to smile. If you smile to that baby age 2 months old, they may reply your smile back. Okay, 2 to 3 months old, they can smile spontaneously without you smiling at them. They can smile and they are able to laugh and interested in the surrounding, but won't be friendly with strangers. This is happen when you are going to work. You send your baby to kindergarten or to the taska. The baby start to recognize you and start to crying when you first send them to taska. For vision and hearing, 1 to 2 months old, they already recognize their parents' voice and the tone. They only see, for baby 1 month old to 2 months old, they only see black and white. They are unable to see the colors. They see black and white and only sharp contrast. They are able to focus up to 12 meters and turns head towards sound. For 2 to 3 months old baby, they are able to cooing and squealing sounds. So baby 3 months old can coo, coo, coo. They can do that. Okay. Able to see multicolor, respond to rattle sounds. Eyes will able to follow object around 180 degrees. Okay. I have a question for you. Okay. At age 1 month old, the baby can see which color? Okay. The baby can see black and white only or colorful. at 1 month old? They can see?
Black and white.
Good. Nice. Very clever. Good answer. So, I want for the nutshell, I would like to show for you some books, the record books that used in our Ministry of Health for 0 to 6 years old. Okay. This is the chart for baby girls. They're supposed to have good or normal body weight in this, we'll record in this white area. If the baby weight fall into the yellow area, it indicates underweight. If in the red area, it will indicate very low weight, and this one indicates obese. Same goes to the length for the girls. It needs to be in this line. If it drop to the yellow zone, the baby might retarded a bit. Alright? Same goes to red zone. It will indicate the retardation. This one is for BMI, body mass index graph. Okay. This is the picture of your baby development. For 0 to 3 months old, we only have to do few things, which is first is reply the smile. Second is able to control the heat. They can roll over, and last one, they can reach for an object. This is the development that baby can do up to 3 months old. Okay. What the nurse and the doctor will check for the first month old is here. For the second month, and special one is for the 3 months old. The nurses will check the development of all these things, whether your baby necks straight out when they are cuddles, whether your baby able to move all the hands and legs, is the baby able to laugh, is it the baby shocked when the loud noise is happen, is it the baby replying the smile on, or is it the baby look at your face, eyes to eyes. Okay, this one. Focus on 3 months and 4 months old. So this is my reference 1, 2, 3, 4 for this assignment. Alright, thank you class for your attention.